So our next speaker is Jonathan Fleece, who I got a chance to meet yesterday, and I think you're going to be delighted to hear from him. Jonathan's the co-founder and leading he's co-founder of Jonathan Fleece, is a leading healthcare attorney with Blalock Walters law firm. He's an advisor, speaker. He's based here in the Bradenton, Sarasota area. He's an expert in healthcare reform laws, including the Patient Protection and Affordable Care Act. Jonathan advises healthcare companies and professionals regularly how to strategically plan for success during the sweeping changes that are coming in healthcare over the next decade. Mr. Fleece, Jonathan, speaks regularly in the business and healthcare marketplace and consults with clients regarding how to optimize their performance in the areas of operations, transactions, legal compliance, and revenues. He works with numerous companies in the traditional business and healthcare spaces. His clients include businesses of all types: physicians, medical groups, hospitals, hospice providers, physical therapy companies, behavioral health providers, healthcare management companies, and ancillary healthcare providers. Jonathan received 2 distinguished awards from Biz 941 magazine. Several years ago, he received the 40 Under 40 award for advancing his career quickly in Florida, and the magazine recently named him as top 20 people to watch for his tremendous contributions to healthcare. Thanks, Jonathan.
Good morning. Thank you so much for that warm welcome introduction. I am Jonathan Fleece, attorney, speaker, advisor, and 5 years ago, my life fundamentally changed with the publication of this book, The New Health Age, The Future of Healthcare in America. After the publication of this book, my friend, co-author, world futurist, David Houle and I started on a journey. And I want to share that journey with you all this morning. As leaders in the world, we are experiencing, as part of our process with the New Health Age, a true global transformation. And at 3.0 Leaders Conference this morning, we have not only the ability, but we have the responsibility to help make the New Health Age a true global transformation. So when David Houle and I were researching and writing our book, we interviewed countless leaders in the healthcare space from across the country, from Capitol Hill to Hollywood Hills and everywhere in between. And what became clearly obvious to us as we were researching and writing the book is that there was so much content in the marketplace today about healthcare and where it has been, where it is today, and where healthcare is going tomorrow, that there was very little context to put that message into an organized form. So we decided to come up with what we call the dynamic flows. And on this 5th anniversary of the publication of The New Health Age, the dynamic flows is an area where we got it right in trying to convey the message of where we're going in healthcare and why. What we have done with the dynamic flows is to try to organize thoughts, perspectives, and reflections on the New Health Age so that you can organize your strategy thinking, your debates about healthcare, and where you take your organizations, your communities, and your own lives in an organized, educated way. We first came up and defined the dynamic flow category as how we think about healthcare will change. The next category under the dynamic flows that we came up with is how we deliver healthcare will change in the New Health Age. And finally, the economics of healthcare will change in the New Health Age. And over the last 5 years, as we've been working again with audiences, boardrooms, companies, policymakers across the country, we've heard over and over again that if you're not having a conversation related to the future of healthcare around these dynamic flows, you're not having an educated conversation. Now, we don't have time to go into all of these today, but I'd like to touch on some of the key components of some of the dynamic flows under each categories here as we move forward. Let's start with the thinking dynamic flow. If we look and think back about how we perceive the new health age or how we perceived healthcare in the 20th century, healthcare in the 20th century was a model built around sickness. How many of you in the room went to the doctor, went or accessed the healthcare system in the 20th century to get well? That's not how we thought about healthcare in the 20th century. In the 20th century, we thought and focused on healthcare as a sick-based model. In the 21st century, as part of the new health age, the whole thinking model is changing. We're moving towards thinking about healthcare as wellness. Perfect example of this is in the Medicare program, one of the largest government entitlement programs in the United States. In the 20th century, Medicare did not pay for annual physical exams. Think about that for a moment. Our largest government, or one of our largest government entitlement programs in the 20th century didn't pay for wellness. That's now changed. Medicare reimburses for annual physicals as the movement towards the new health age continues. Delivery, reactive to proactive. When David and I were speaking before a durable medical equipment company convention in Nashville, Tennessee, early on in the new health age movement, we ran across a company that was transforming the emergency room and the fabrics that were installed and used across the emergency rooms in America today. In the 20th century, bacteria is everywhere in the emergency room. That was a reactive process to having to deal with infections due to bacteria that was being caught in curtains and fabrics in emergency rooms. This company, before the convention that we spoke to, developed a whole new technology around being proactive under the delivery of care by creating, through nanotechnology and synthetic fabric materials, curtains that could be spread and materials that could be installed in emergency rooms across the country that would reduce and eliminate infections contracted and procured in emergency rooms. The changing of delivery of healthcare. And then the economics. Procedures moving to performance in the new health age. Going back to the first thinking dynamic flow about how healthcare in the 20th century was a model that was really focused and we thought about it as a sick-based model, the same is true under the economics. That's how healthcare providers and the delivery systems got paid. In the 20th century, they got paid for procedures. The more admissions, the more patients, the more procedures, that's what drove the revenue model in the 20th century. In the new health age, we're moving towards and are in a model based on performance. Example of that is in the area of pediatricians and pediatrics. In the 20th century, pediatricians were some of the lowest paid physicians in the marketplace today. As we move into a performance-based model, I have clients and advise pediatricians in the new health age that are now amongst the highest paid healthcare providers in the marketplace because they're now being paid to keep patients well, keep patients out of the hospital. Take an asthmatic child, for instance. If the pediatrician does an effective job of keeping a child with asthma under control and managed and out of the emergency room, the physicians today, under the performance-based economic models, are getting paid incentives and bonus payments to accomplish that objective. They're being paid, and the economics are being based on that performance-based model. So that's where David and I in the new health age got it right. But what has surprised us the most about the last 5 years? Because as we've talked to audiences and clients and boards across the nation, What have we taken out of that listening that has been surprising? William Gibson said it best in a quote, "The future is already here, it's just not evenly distributed." I'd like to modify that quote briefly and say that the future of healthcare is already here. It is just not evenly distributed. That's what has surprised us the most, is that there are absolutely pockets of success and models across the United States and the world that demonstrate the new health age and where we're going and why, but it's not evenly distributed. I'll give you a few examples. Health City in the Cayman Islands. Dr. David Shetty is one of the physicians that we highlight in our book, The New Health Age. Dr. Shetty has hospitals across India and was one of the case models that we highlighted 5 years ago when we were researching and writing the book. Dr. Shetty at that time was treating the poorest of citizens in India for costs at a fraction of what the American hospital systems can provide for the same procedures and surgeries, but for outcomes that were much, much better than even some American healthcare and hospital systems. And when we were writing and broadcasting that message across the United States and across the globe, audiences didn't believe us. They're like, "That's in India. There's no way that that could happen in America. Something is unique about that model." Well, Dr. Shetty is now doing that 400 miles plus south of Florida in the Cayman Islands through Health City. Dr. Shetty has opened up a hospital at a fraction of the construction costs when compared to building a hospital in the United States. And his outcomes are as good, if not better, than some of the leading healthcare institutions in the United States for 10 to 20% of what it would cost to have the same procedure, the same surgery in an American hospital system. The future is here, it's just not evenly distributed. Cure for You. The founder of Cure for You is here with us this morning. Cure for You is about using health information and health technology to empower human beings. Cure for You is taking all of the health data out there on a person-by-person basis and bringing it down to the individual through patient portals, through health cards, through data and analytics, and other incredible technologies that are not only informing and educating healthcare providers about the information and the analytics that are out there, but also powering the individual to change and transform their lives. And then finally, an example of where the future is here in the new health age is a company that I'm affiliated with called ACAP and their Naturally Slim product. ACAP focuses primarily on corporations and self-funded health plans across the United States. And they are focused on several key areas. One is looking at the employees that have what's called metabolic syndrome. If you're not familiar with what metabolic syndrome is basically the core measurements that the human body produces and that we measure to assess what physical state are we in. It looks at high blood pressure, cholesterol, blood sugars, body mass index, and other key measurements and standards that we measure our human bodies against. ACAP segregates out the employees across businesses and corporations in America, and through their product, Naturally Slim and other innovations, reduce employees with metabolic syndrome by, in many cases, up to 50%. Now, what does that mean for those corporations? Number one, it means tremendous economic savings within their health plan dollars and in some cases have reduced health plan spending by up to 40% in Fortune 1000 companies across America. By simply identifying workers across a population of a workforce that are at risk or have metabolic syndrome and that need to be managed to reduce those healthcare costs. But here's the other huge benefit to what companies like ACAP and Naturally Slim are doing for corporations and businesses across America. By getting employees healthier, they are taking employees and engaging them more in their daily lives. Absenteeism is going down, worker productivity is going up, and companies are becoming more successful because of engaged and healthy workforces. We predict in the new health age that a day will come that Wall Street not only measures companies and stock prices based on their earnings, but also measures companies and stock prices based on the health and fitness of their workforce. The future is here in the new health age. It is just not evenly distributed. So what are some other factors that have created this slow pace of change despite the new health age examples that I've mentioned? One is lack of awareness. I'll poll the audience this morning. How many of you knew before I defined and talked about metabolic syndrome what metabolic syndrome was or is? Metabolic syndrome is the foundation for hundreds and hundreds of chronic diseases. And if you have too many of your health metrics that I mentioned earlier, blood pressures, blood sugars, BMI, that are out of balance, that are not where they need to be, your risk of chronic diseases go up dramatically. So one of the areas where we believe the new health age is taking on slower than it should and that we as leaders can change is in this lack of awareness area. 2, harmful behaviors. Behaviors are very, very hard to change. Do we have the apple at night, or do we have the bologna sandwich when we're standing before the refrigerator? Do we exercise, or do we watch TV? And all of those human behaviors have a great, deep impact on our health, fitness, and the new health age. Look at obesity rates. In the United States today, nearly 2/3 of Americans are overweight, and over 1/3 of Americans are clinically obese. 40% of people born after 2000 will develop diabetes in the United States. That is a staggering number, and will absolutely slow the pace of change as we move into the new health age if we as leaders don't do something about it, because we have the knowledge, we have the power, we have the responsibility to help gain awareness around these issues. Food, water, and air quality. Are we eating healthy foods, or are we eating foods that are genetically modified and full of chemicals? Are we drinking clean water, or are we drinking water with toxins? And the air we breathe is literally killing us at rates higher than the rates of cancer. More people are dying today from air pollution than cancers. Slow pace of change, but the new health age is moving forward. The future is here. It's just still not evenly distributed. Drew Altman, president and CEO of Kaiser Family Foundation, stated recently, "We have no national policy on healthcare costs and will not have one anytime soon. Liberals, conservatives, and healthcare big interest could never agree on one." That's another driver of this slow pace of change. Douglas Holtz Aiken, president of American Action Forum. The place where spending is growing substantially faster than the economy is hospitals. Hospitals make up the largest segment of healthcare spending in the United States. And with spending going up faster in that segment than other areas of the economy, how are we going to bend this cost curve and move into the new health age in a rapid and empowering way? So, why this slower pace of change in healthcare than David and I expected over these last 5 years as we've traveled the world talking about the new health age? It boils down to this: lack of leadership. Lack of leadership amongst policymakers, lack of leadership amongst the business sector, and lack of leadership in our communities. But guess what? We, the leaders in this community and this nation, have the power to change that. We are the leaders. And it's time to stop casting blame against those policymakers that can't reach consensus on how do we reduce costs and increase quality in health care. We have the power to make that change as leaders. So where should leaders take us? We, the leadership of our communities, into the new health age. I propose a new comprehensive definition of health is what it will take to move us truly into the new health age and continue this movement towards a global transformation in health and healthcare. A new definition. What does that look like? That's supposed to say mind. Testing your mind. Is your mind healthy? Are you thinking positive thoughts or negative thoughts? Are you embracing the lessons as a lifelong learner, or are you stuck in the mud in the thoughts of yesterday? Do you have a healthy mind? And do you have a healthy body? Are you making those right choices around what you eat, around what you drink? Are you active? Are you inactive? Do you have a healthy body? That is another fundamental component of the new definition of health. And soul. What are you filling your soul with on a daily basis? Full of love or full of anger? Are you lifting people up or are you tearing people down? And finally, being. To be a healthy being is a healthy mind, body, and soul. And what are you doing with that being? Are we elevating our beings to this place of a healthy mind, body, and soul, or are we not? Because I think if we redefine the definition of health around mind, body, soul, being, that is what will create the spark. That is what will create the inspiration that empowers companies like ACAP and Naturally Slim, that will enable technology firms like Cure4You to spread that technology across the globe to transform people into health. So what is next? I'm going to play off of Tony Collins' inspiration from this conference. What is next for me? What is next for you is a new narrative. A new narrative around the new health age. And that new narrative is to be for health. Everything I do moving forward in my law practice, in my advisory services, in my education, and in my speaking is to be for health. And I want to encourage, challenge, and hopefully inspire all of you to create a new narrative as well, to be for health. Because with all the technology in the world, and with even clean food, water, and air, if we are not living with healthy minds, healthy bodies, healthy beings, and souls, are we really being for health? I would love for you all to stay connected with me on Facebook, Twitter, LinkedIn, and other social media platforms. There will be more of this new narrative to come. And thank you so much for hopefully joining the movement to be for health as the new health age becomes a global transformation in the 21st century. Thank you very much.